welcome to this video on healthcare degrees. We'll be covering medicine and dentistry, and even though we don't have other healthcare degrees within our team, we also wanted to tell you about midwifery, nursing, pharmacy and allied health courses. Do check out our corresponding blog post on bioscience and healthcare degrees. The link is in our bio.
Science underpins a doctor's daily work and improves patients' lives. The science that you learn in a medical degree is generally categorised into human anatomy, which is how the bones and the muscles fit together, then physiology, which is how the body carries out its function, and behaviour, which might include how emotions and beliefs impact a patient's wellness. After understanding how a healthy body is, medical students might learn how diseases arise and then learn how to treat them. But science is only one component of the degree. A doctor needs to have communication and practical expertise in order to help their patient get better. Medical students get lots of opportunities to talk to patients and refine their listening skills during placements. Medical schools also teach clinical techniques, such as examining an arm for nerve damage or using a stethoscope to listen to your heart and also your lungs. Medicine is a 5 or 6 year degree depending on where you go. Pretty much all medical schools offer the option to intercalate, which means taking a break from medicine for a year to study something specific, such as neuroscience or global health. There is also a 6 to 12 week elective period in your final year, which offers you the opportunity to travel and experience medicine elsewhere in the world. Medicine opens so many doors to so many different specialties. You could be a GP in the community or a cardiothoracic surgeon in a hospital. And you don't have to become a doctor after you graduate. Plenty of people go into research or teaching, and many people do this alongside being a doctor.
Dentistry is a course that combines aesthetics and an eye for detail with knowledge of the human body and anatomy. It's often overlooked when you consider your university choices, as it's a career that people generally don't know that much about, and it's quite difficult to understand it from the outside looking in. A dental degree starts off really similar to medicine. The first year is focused on pharmacology, physiology, anatomy, biochemistry, and it acts as a foundation for the clinical work that follows. By the time you're in your second year, you're working on fake teeth in sort of phantom heads, and you're going to start seeing your first patients. From your third to your fifth years, you start acting quite independently as a practitioner, treating patients with varying complexity and varying dental needs. So you see a lot of pediatric cases and adult cases, and you also will start taking out real teeth and doing a lot of procedures. You'll do dentures, fillings, root canals, all while you're at university and as a dental student. Dentistry opens the door to many different careers. You can be a general dentist within the NHS, you can be a private dentist working in private practice, or you can become a specialist in certain parts of dentistry that you really enjoy. You can do root canals, crowns, dentures, paediatrics, all as specialist training pathways, and you can really hone in on areas of your interest. You could also work as a clinical tutor or as a clinical lecturer in a dental school, teaching new dental students and publishing your own research to help further the profession. Some dentists will go on to work in prison dentistry or for Public Health England, where you can help develop population interventions to improve dental health in the UK. The course itself is challenging, it's academic, and it's a real test of manual dexterity. But if you're looking for a career that combines different passions from the arts to the sciences, then dentistry is absolutely an excellent choice, and it's definitely something worth considering.
A nursing degree is usually 3 years long and is split half and half between studying at university and going on a variety of clinical placements in lots of different healthcare settings. You will obtain a degree in one of 4 areas of nursing: adult, children, learning disability, or mental health. There are some degree courses that offer dual qualifications, so you can train in 2 of these areas. Adult nursing is the most flexible and the most broad, with more options later on for specialisation. In your first year of nursing, you'll study the basic clinical concepts and procedures, and from the second year your content will be much more tailored to whichever area you have chosen. You will also spend a lot of your time on clinical placements where you'll be supervised by registered nurses. This will ensure that you gain the skills that you need for when you graduate. In an adult nursing degree, you can expect to cover topics such as public health, long-term care management, complex care, and leadership. Most people upon graduation will go on to work as registered nurses. However, there are loads of different options within this career. You might work in a variety of healthcare settings, such as in hospitals, GPs, in schools, prisons, hospices, or in the community. Nurses are part of the multidisciplinary team at every step of the patient's healthcare journey. There are also options for further specialisation within nursing in fields such as oncology, which often require further study and training. Not all nursing graduates work as nurses though. There are opportunities to be managers in the healthcare sector or in NHS trusts, strategic roles within the healthcare sector, and options for work in social welfare and counselling.
Midwives have a very separate and distinct role from nurses, and they're highly specialized in the sense that they focus on the entire process of pregnancy, labor, childbirth, and the postnatal recovery period. So during a midwifery degree, it's usually a 3-year degree, and students will start with learning and understanding the normal physiology of pregnancy and childbirth, as well as learning the skills that they would need. It's largely practical. So from the very first year, students will be doing placements in the community and in the maternal units of local hospitals. So midwives are highly specialized. So there are different jobs that can originate from studying this degree. So midwives can start by being assistants, and they can grow until they become ward managers, for example. Midwives can also take up roles in the community, working with the GPs, assisting with home birth. Of course, they can also take roles in management and public health, so working on health policies, for example, and they can also get involved into teaching and mentoring. So many pharmacy degrees are actually 4 years long because they include 1-year placement in industry or in a pharmacy. And during the pharmacy degree, you will mostly focus on understanding the pathophysiology of diseases, as well as focusing greatly on the treatments. So you will learn the reasoning behind why certain drugs are used for specific diseases, but also things like the process of drug discovery and development, as well as the regulatory bodies that can approve or deny drugs. You will also learn more practical aspects, especially during the year placement, such as consultation, dispensing, and some clinical skills, such as blood pressures and temperature monitoring. So we all know that the classical job outcome for a pharmacist is to work in the community in a pharmacy. However, many pharmacists can actually work in GP surgeries or in hospital pharmacies, as well as being involved in research and academia, in pharmaceutical companies, running clinical trials, and really bringing the drugs from the bench straight into the clinics.
There are a number of allied health roles which play an essential part within the NHS. There are 14 allied health professions, which are art therapists, diagnostic radiographers, dietitians, drama therapists, music therapists, occupational therapists, operating department practitioners, orthoptists, osteopaths, paramedics, podiatrists, prosthesis and orthotists, speech and language therapists, and therapeutic radiographers. Most of these do have a corresponding degree course that you need to go into these roles. Any given course will usually involve learning the theory and putting it into practice on placement. The skills that you gain will be essential for when you graduate and fulfil the role. All of these involve working with patients, often in the NHS, which can be challenging but also incredibly rewarding. For more information on each of these roles, check out the NHS Health Careers website.